I'm Dr. John Giannini, and I'm the medical director of the Simulation Center here at ACOM. And simulation, especially the way it has developed, is probably the most innovative teaching modality in medical schools today. And the reason I can say that is because it's experiential learning at its best. Our students go over to the auditorium, they get lectures, but then they get to come over here and experience it in a real patient encounter. And there's just nothing better than that. They live and breathe it, they get involved in it, and they get to see it actively in front of them. And we love doing it. So when the students are studying, say, cardiovascular medicine, they will come over here and they will do a myocardial infarction one week. The next week they'll do endocarditis. The next week they'll do a pulmonary embolism. And they get to experience and learn some wonderful cases just by doing them. And then, you know, the really gold piece of this is afterwards we sit down and we talk through the case. We do a 30-minute debrief and talk through it in what we refer to as soap note format. Go through the case, what the symptoms were, what physical exam did you do, what is your assessment, what labs would you do, what imaging would you do, and we talk through the case all the way from the beginning to the end. So they walk away really knowing what that case and that disease is all about. And you can just see them get better and better and better. It's another special arm to learning medicine that especially we use Body Interact, as you know. And the nicest thing about it is that after they go through and do the case, then they get a tremendous evaluation on all the things that they did good, all the things that they did wrong, what was priority, what was high priority, what was low priority. And you know, that's its own debrief. That's its own wonderful debrief. And fortunately, when we use it with our students here, I get to sit in and help them, you know, think their way through that afterwards. But it's another kind of arm, and it's a great way of teaching without anybody getting hurt. You know, it's just really another arm that we've found and have used it, as you know, for competitions, and it's being used a lot of different ways. We have used it for our fourth year assessments of our student clinical assessments. We've sent it to our students as a part of evaluating them while they're on their clinical rotations. And it was very effective, very effective.
I am Di Walker. I work here at the Alabama College of Osteopathic Medicine, and I serve as a curriculum coordinator. And it's a lot of fun working with the students. One highlight is they don't get grades when they come here, so they can relax and learn, which is the best platform that you can provide for them. We're very encouraging. We work well together. I think we're all passionate about what we do, and that's key. You know, you can have a lot of modalities, but if you don't have a group and a team like we have here, we couldn't do what we do. It would not be effective.
Hi, my name is Jim Nolan. I'm a family nurse practitioner. I'm one of the simulation educators here, and Body Interact has been somewhat of a game changer for us during the COVID pandemic. We had to find ways to still provide our students the clinical experience, but we were doing it with some of them in California because they couldn't travel. And we had to find ways of doing it when they couldn't come on campus. And Body Interact was very helpful with doing that, where we was able to give 200 students the exact same clinical experience, same scenario, in a synchronous but sometimes asynchronous situation, and then still provide that rich debrief by Dr. G virtually via using Zoom. So it was very helpful. Body Interact has been very useful for that. We're continuing trying to include it more in the curriculum. We used it for the overdose toxicology for PCS, where each of the students got to do the drug overdose case in Body Interact, and they all loved it because they got a chance to put into practice some of what they've learned. They got to do it on that computer in a safe environment, but also by themselves. So it was a one-on-one, and the great thing is they got a chance to redo it. So I'm like, hey, I killed the patient. Let's hit reset, and you get to do it again. That's the thing you don't get in real life. That's one of the great things about simulation.
You can't learn and practice and evolve your critical thinking skills unless you do it taking care of a patient. You don't just read about how you do it and do it. You have to make those decisions on the fly. And simulation, body interact, they all teach that if you do it. And you think about it and you get seriously involved in it. And it's a hard thing to document, if you will, but you don't have to be here very long to watch these students go from the beginning to the end and just see how much they improve by doing cases, be it simulation or body interact, you know.
And it's been exciting that we were able to incorporate the teamwork. You know, that's really a big part of what we do here is students working, appreciating, respecting each other's roles. And a lot of times when you do it virtually, you send the program, you're off in your apartment, they do the program, we get results. It was so cool that we could incorporate that team experience with Body Interact. You know, it's just gone so smoothly, and any little problem that we'd have, we'd write you or some of your colleagues, and instantly we got feedback, and just very, very pleased with that. We could not have moved forward without y'all's help. So thank you.
Yeah, when we did that attestation last year for like 190 students, we did it we made them all do it in the same time frame. So we had like a 3-hour window. And during that, we had some issues, but I was on the phone, on the computer, and your support team fixed things instantaneous. They were amazing.
It was great.
And they were great to troubleshoot students. If I couldn't help, we'd give the students their email, and they would fix it. It was just amazing. You don't get that type of support from many companies.